Yes, hello.
Abhishek sir, you proceed it
Yes.
as a moderator. Yeah.
So, good afternoon to all. First of all, I wish all a World Breastfeeding Week 2020-22. And today we all are here for the webinar that is based on the theme Step Up for the Breastfeeding, Educate and Support. The session will be taken by Dr. Ketan Bharadwaj sir, MD Pediatrics. First of all, I would like to thank our patron, Dr. Suvesh Khanna madam, who has given chance to organize this program. Also, I would like to thank our national president, Dr. Binu Joy sir, who has always been supporting and advisor for this event. Also, I would like to thank our chapter president, Dr. Indravati Rao madam, their an active support in organizing any webinar or event. Okay, for today's event, first I would like to introduce our speaker, Dr. Ketan Bharadwaj sir. Sir is the director in Masoom Children Hospital, Neoplus ICU Surat. I will present a brief data about Sir. Sir is the president of Infant Young Child Feeding Chapter of Indian Academy of Pediatrics from 2019 to 21. Sir is also the president of Human Milk Banking Association in 2020-21. Sir is also the president of Perinatology Forum of Surat in 2007. Sir is also the president of Surat Pediatric Association, SPECT, in 2006. Sir is also board of study member in various university in all over Gujarat, in Children University also. Sir is the coordinator of various programs like breastfeeding and human milk bank promotion, the project RED, SPECT, also the P4P, the Parenting for Peace program. Sir is the national trainer for poor scholarship performance program. Also the Ask IAP, all about fever, intake, drum and NAPU. Sir is the founder of Suraksha. It is the project which is against the child sexual abuse. Sir has various and vast experience in pediatric nursing and got various awards from national and international agencies like Sir has the Limca Book Award for breastfeeding donation camp. Also, Sir got WOBA gold medal in 2008 for breastfeeding promotion. Also, a fellow of Indian Academy of Pediatrics in 2017 and by Indian Academy of Pediatrics, the unique community service in 2019. Sir has published various books and papers in various national and international magazines. Sir has published the IAP guidelines, which includes the IYCF, human milk banking, micronutrients, early childhood development, and vaccine storage. Also, Sir has published few of the books like Feeding from Fundamentals, Secret of Learning, and Mental Health of the Children's. Sir also published the articles in many IAP and IMA publications. Sir is the visiting faculty and examiner in various university of Gujarat, all over the India actually. And Sir is the visiting faculty in PG Diploma in Dietetics, Learning Disability, Counseling and Physiotherapy. It is very small introduction about Sir actually. Sir has vast experience in the field of child health, pediatrics. So I am welcoming Sir to initiate their session and guide all the participants. Thank you, sir, and welcome.
Thank you, Abhishek ji. Very good afternoon to all the delegates over here, and a very happy World Breastfeeding Week this year.
हाँ मैं भी
I am thankful to the Nursing Society for giving me this opportunity to interact with you all. I am thankful to the President, Secretary of the chapter, and the National President and Secretary, and all the office bearers. There are few friends I can see here. Kiran Bhai, how are you? And there are a few more people are there. I am not able to just now greet everybody, but greeting from Surat. Not taking much time. Let me start because time is very precious. And friends, as you know that this year the topic of World Breastfeeding Week is Step Up for Breastfeeding, especially for education and supporting the breastfeeding. Going in those lines, what does it mean? It means that a lot of many domains or many stakeholders are there who can play a vital role in supporting and promoting breastfeeding. And the obstetricians, pediatricians, general practitioners, nurses, and the frontline workers, they are the key people. And we should educate all of them, support all of them so that they in turn can support breastfeeding in their own way, in their own working areas. And thus, everybody should gather together and make a big impact on breastfeeding in the world. I'm sharing my screen. So I will be talking actually not the very nitty-gritty of this year's World Breastfeeding Week theme, because you all know about breastfeeding. What is the importance of it and everything. What my target is today to highlight you the various scientific aspects of the advices regarding breastfeeding that we give to our lactating mothers and antenatal mothers. And ultimately, how to go in for a successful breastfeeding as a nursing practitioner or as a doctor. That is very crucial, because unless we know our own practices, we cannot improve others' practices. This is Madam, who is the first qualified lactation consultant at our place, and we run a mom's breastfeeding clinic at my hospital. It is first of its kind in South Gujarat. Friends, we know that breastfeeding is very important, but are we very serious about it? No. The data from National Family Health Survey shows that we have got very poor early initiation of breastfeeding. A reasonably good, rather some way we are improving in exclusive breastfeeding up to 6 months of age, and we are very, very poor in complementary feeding. So ultimately what happens is that our children, they grow poorly and they'll end up with malnutrition. The World Breastfeeding Trend Initiative report card is published every year, and we rank 79th out of 150. And our score is 45 only out of 100. Man pass thaya. So this is the most crucial platform where I can interact with you all, and I can give you some, though you all know many things about breastfeeding, but this should be brushed up And all these things should be put into practice. Unless we put the things into practice, we cannot get any result. So here, the 10 successful steps or keys to breastfeeding at individual level that you will be practicing in your practices are antenatal counseling, proper. I will go into all the details of these points in later slides. That antenatal counseling is very important. Confidence building and support to the lactating woman and the pregnant woman and the family, the whole family. That is very, very important. And actually, it is said that breastfeeding is more of an art and more of a confidence trick. So, this part that we should keep in our mind, and while talking to the mothers, let it be more of confidence building and helping and supporting the art of breastfeeding rather than just theoretical things. Early initiation of breastfeeding with skin to skin care, latch and position are the most crucial uh, points which should be uh, tackled in timely way. Otherwise, we miss the bus, and most of the lactation problems they start from missing the bus at point number 3 and 4. And again, frequent suckling is the key to increase the breastfeeding output. Bedding in of the child helps the child and mother and the oxytocin reflexes to set in timely and in proper quantity so that a lot of milk can be produced. Exclusive breastfeeding on demand later, and then monitoring and early management of the problems. And counseling of working mothers is very, very important. And ultimately, we have to demystify that infant milk substitutes, the powdered milk formulas, they are not good. So, breastfeeding support. Now, why? It has been seen that if breastfeeding support is provided to the mothers, the newly delivered mothers, through a program that is known as Breastfeeding Friendly Hospital Initiative. This program is known as BFHI in short. Please mute everybody. Yeah, except me. So the breastfeeding friendly hospital initiative is there all over the world, and we in India have got this initiative being done at few places, and we certify hospitals that these are breastfeeding friendly hospitals. And there are a list of criteria for it being breastfeeding friendly. And this year, Breastfeeding Promotion Network of India has declared its own theme that support breastfeeding through a proper implementation of BFHI. Why? So it leads to increased breastfeeding in the first hours, and more children are likely to breastfeed on the first day at home also. And exclusive breastfeeding rates improve a lot. Skin to skin contact also improves. Breastfeeding difficulties they lessen, and there is significant less use of pacifier. And 90% reported that antenatal information simplified the breastfeeding experience. So there comes the importance of antenatal counseling. It means that one should, all the pregnant women should get proper antenatal counseling, at least 2 sessions with proper time by a proper counselor, like say nursing staff, which are qualified and which are trained in IYCF and breastfeeding practices. Then this antenatal counseling has got a great impact on the breastfeeding rates. Or the breastfeeding rates, whenever I tell breastfeeding rate, it means that early initiation of breastfeeding, exclusive breastfeeding, and establishment of adequate breastfeeding within 2 to 3 days. So the antenatal counseling is extremely important, because that if the mother has not been given antenatal counseling properly, then she ends up immediately after birth of the child, she ends up in a very confused state. The whole thing is not very pleasant in all the mothers. It happens that in the books and in the storybooks and in the novels and in the films, they see that all things, goody goody things, that once a mother delivers, she automatically gets a lot of love and the child, both they are happy. But actually speaking, on the ground, these are not the things which happen with all the mothers. So, and the whole process of breastfeeding may become a scary thing or a nightmare for a new mother, especially who have not been antenatally counseled. So, antenatal counseling will reduce the fear, will improve the confidence. The mothers, they will know what they have to do immediately after the birth. Actually, without antenatal counseling, all of a sudden, if the mother has to face breastfeeding and the stress of delivery, she is overwhelmed and her confidence often breaks. And especially the family members who are very protective for her will definitely go into giving the pre-lacteals or animal milk in the time of first 3 days when the breast milk is in less quantity. Out of their ignorance and out of the ignorance of the nursing staff also and the doctors also, including pediatricians and neonatologists, everybody. So do family counseling in the antenatal period with father of the child if he is available there, all the close relatives who are going to take care of the child in the mother in the immediate postpartum period. You have to build the confidence because these mothers, they got a lot of anxieties. Such fear, there are few anxieties which they cannot speak out also. Say, small breasts is a point of anxiety for many mothers. And previous failures of breastfeeding in previous pregnancies, pain, and how she will do it. And as such also, the mental status of immediate postpartum mothers is a bit low, and often the mothers, they have got depression in the late pregnancy or in the immediate postpartum period. So all these things have to be tackled by making the pregnant woman and the mother talk more. So the key to counseling antenatally or postnatally is that you have to speak less and you have to listen more. The more you listen, the more the mother will open up, and you have to listen non-judgmentally. Don't give any judgment to what she is doing is right or wrong. Just feel, listen, that whatever she is doing is the reality that has to be rectified. Mr. James Mogaria, you are, please mute yourself. Mr. James Mogaria. Can somebody call him? Yes, thank you. Thank you, Kiran. Oh. Abhishek ji, can you call him? I am myself not able to hear my voice. Okay. So then you have to also tell the mothers and the family that what are the advantages and benefits of breastfeeding to infant and the mother and everybody. Here, let me first recapitulate those benefits. See, the infant gets the best gold standard start from the birth with colostrum and the breast milk. And there is no other feed which is anyway nearer equivalent to breast milk. Again, here you have to clarify that infant milk formula, etc., that is available in the market, the animal milks, they are all very, very inferior to what is breast milk of the mother herself. So, and that advantage is are passed to the infant in terms of reduced rates of infections, various types, reduced rates of tummy problems, reduced rates of pneumonia, diarrhea later in their life, and the child becomes more intelligent by 4 to 7 points in IQ later when the child grows up as compared to all other children who are not breastfed. And also such children, they are having less frequency of diabetes mellitus and asthma and many allergic problems later in the life. And these children, they are more mentally stable. They are able to manage crisis in a better way. And the mothers also get a lot of benefit. In the initial period, her postpartum loss of blood is less, and that's why she becomes less anemic, and she gets immediately relaxed feeling once she feeds her child, and she loses a lot of calories also, so she doesn't become obese later. And after that, the advantage is they continue in her old age also. The mothers who have breastfed their children for a long time, their bones are more stronger, so they end up with less of osteoporotic fractures later in her old age also. Apart from this, such mothers, they have got less of ovarian cancers, less of breast cancers. So these are all many advantages to the mother, to the infant, and to the environment also. How? Environment means that if instead of breast milk and you use, if you don't put in a lot of efforts to support the breastfeeding, and if it fails, then the use of infant formula tins, they increase the carbon footprint or the carbon load in the environment, and to a very large extent. And thus environment is polluted in the form of the whole processes of producing the infant formulas in factories and transporting them and packing them and making the milk from the infant formula and whatnot. So it is helpful to the environment, and then it is also helpful to the whole society and the government. See, if the child is breastfed, they become less ill. The mothers also, they become less ill, and they save a lot of money. It is said that in small countries like Ghana, the total milk produced by the mothers, if is equivalent to the cost of GDP, about 10% of GDP of that country. So it is overseen, or rather undervalued thing by the government also at present. But to our happiness of late, for last 7, 8, 10 years, government has become very proactive, and lots of steps are being taken to support and promote the breastfeeding and protect the breastfeeding. I will come to that later. So harms of bottle feeding and formula should be explained to the mothers and the family members antenatally. And what is early initiation of breastfeeding, how it will be done, how skin to skin contact should be given, how the colostrum should be fed, and how the baby should be cared with the mother in the initial days till the breastfeeding is established, and how zero separation policy can be managed. And exclusive breastfeeding means no pre-lacteals. And the most important thing they should be taught is proper latch and position, about which I will come in later slides. So anything else to be seen in breast antenatally? Though it is very, very rare to see hypoplastic breasts, but this is one of the causes for sure lactation failures. Otherwise, main thing is do not comment negatively on breast or nipple of the mother while seeing the mother's antenatally. No negative comment should be passed, even if you see a retracted nipple or a flat nipple or hypoplastic breast. Always give encouraging words so that her confidence is boosted. And take it from me that nature is so powerful that a lot of such problems, they are circumvented in many, many ways. So never give any discouraging words to mothers. These are hypoplastic breasts, and these breasts, they never become fuller or they never develop during the pregnancy. That is one of the key point. Inverted nipples, even if you see, do they need any antenatal care? No. You don't have to do anything to the inverted nipples antenatally, and it is not helpful. On the contrary, it may be harmful in the sense that it may cause cracks because the nipples, they are not very supple in the pregnancy, and they become supple only after the delivery, when the baby sucks and there is application or the baby saliva and the breast milk, it comes in contact with the nipples, they make it supple. And uh, even the inverted nipples or flat nipples, once the baby sucks in proper way, with proper attachment and positioning, most of the nipples, they come out and the problem is solved. So other exercises, various devices in antenatal period to manage the antenatal inverted nipples or flat nipples, they are also not suggested, not recommended. So this is one of the commonest misconceptions among the doctors also, obstetricians also, and nurses also. So please do not manage any inverted nipples in antenatal period. Only thing is that you be prepared to give more support, more skilled support in proper latching and positioning of the baby once the baby is born. Now, the first 4 weeks are very, very crucial for breastfeeding support that you are going to give to the mothers. It has been seen that most of the decrease in the breastfeeding rates are there in the first 4 weeks only. And that is because of lack of confidence, lack of proper support in latching and sucking, and lack of individualized encouragement. Very, very important. All the mothers need to be encouraged. And once when you fail in this in first 4 weeks, most of the breastfeeding failures, they set in. So these are all very subtle things which we overlook in our practices. And here is the key to what is happening actually in the breastfeeding that you should know. And then only you will be able to visualize that what you should do when. Here you can see that from conception to birth and 3 days after that, especially this period from 16 weeks to 22 weeks and up to 3 days of the birth, after the birth, this phase is under endocrinal or hormonal controls. It means that in this phase, there is a lot of progesterone in the woman's body, and that inhibits the spontaneous production of breast milk. And it has got its own reasons. And otherwise, the mother may start producing a lot of milk in early phases, and there will be a lot of problems. So these progesterone levels, which are high, immediately falls after the birth to a very low level by 3rd day of life. And once this progesterone inhibition stops, the surge of the prolactin has started by that time. And so that in the first 3 days, under the progesterone control, there is less of breast milk production. And after 3 days, the milk comes in and a lot of milk is produced. And after 2 weeks, the milk becomes mature. That means that at birth, when there is colostrum and low content of the milk, that becomes copious and it turns from colostrum to transitional milk to a mature milk by about 3 to 4 weeks of life. And after the 3rd day of life, this whole system, whole production of the milk is under autocrine control. Now, what does it mean? Autocrine control means that the local chemicals are there which they control the production of the breast milk. What does it mean again? That the more the breasts are emptied, the more the milk is produced. That is local. There is one local inhibitory factor, lactation inhibitory factor or milk production inhibitory factor, which is increased when the breasts they are full and distended, and once they are emptied, the prolactin again comes into play to increase the milk production. So once you understand this natural process, you will be able to make out that this first 3 days no mother will have it, and the nature must have thought of this period that the child, how the child will survive. The modern science has come for only last 60, 70, 80, 100 years. But the human beings have been there since ages. So this period has to be managed properly, and because of our modern misconceptions in our practices and our over-enthusiastic involvement without proper knowledge, most of the infant formulas, they start here. This is the period when, for the first 3 days, the babies, they need a very less amount of milk, and they need to lose some weight. Which weight? In the womb, the babies, they are in amniotic fluid, and the whole body of the fetus is full of water, and that water sheds off after the birth to up to about 8% of its birth weight. So this shedding off occurs only when there is less quantity of breast milk, and the stomach size of the newborn baby, it is very small. Say it is of size of a cherry at birth, and then slowly it increases to the size of a lemon by 3 days, and by size of a big egg by age of 8 to 10 days. And then slowly the capacity increases. And most of the newborn babies, they have got brown fat. So those babies who are born at full term, they have got a lot of fat in their system, and the liver is also having a lot of glycogen, and the colostrum is having a lot of again such factors which are helpful to the child to shift their metabolism from sugar to fats. And so the ultimate calorie requirement of the newborn babies is met with smaller amount of colostrum only. So this is the science behind it. Now let us go further, that the first 2 weeks are again very important. Why? Here you can see, here just that those babies who are managed properly in the first 3 days have got optimal breastfeeding. And this management I will discuss in the coming slides. And those babies who had suboptimal breastfeeding, they separated out from after 3 days or a week of the life. So it is the first 3-4 days that is most important. And you have to manage the early frequent breastfeeding in a proper way. And these first 2 weeks here, you can see, after that first 2 weeks, this is the maximum gap that occurs in between. So you have got first 3 days and first 2 to 3 weeks, which are the most crucial, where you should be able to manage the breastfeeding in a very sensitive way, in a very scientific way. The frequent suckling, we always, that we all advise a lot of frequent suckling. Why frequent suckling? And that frequent suckling should be in the first 2 to 3 weeks. That is because it stimulates the expression of genes for milk secretion. in the alveolar epithelium of the breast, and the prolactin oxytocin reflexes are set in. And later, after the reflexes are setting and after the breastfeeding is established, you don't need a lot of prolactin later. Okay, so this is the reason why you should have a lot of suckling by the newborn baby. Now, let us come to what we all advise that you start breastfeeding in the first hour. Do not separate the baby from the mother. Zero separation policy should be there. Why? Let me tell you why is it so. That the early initiation and early skin-to-skin contact right on the labor table or right on the cesarean table now also leads to a lot of good things. The mother's immediate love and body temperature to the child is delivered. The breast temperature increases by 0.5 centimeter within 2 minutes. The baby is on the breast. Now see, nature is so fantastic that this kangaroo mother care is very much helpful to these babies. May it be full term and more so in preterms and low birth weight, uh, where giving kangaroo mother care protects the baby against the hypothermia. The breast temperature increases by 0.5%, and that too immediately within 2 minutes. A baby on the breast immediately skin to skin helps better milk removal. For each rise in degree of the breast temperature, more of milk is produced, and babies can,
सर
especially the
5
weak,
વર્ષથી મને સર્ટિફિકેટ મળશે.
especially the babies who are weak. The host, please mute everybody. You can mute everybody from your part. The host can do it. So, and there is reduction of the stress of the birth in the newborn also, the heart rate and everything, they settle down. And the most important thing is that once the baby is put immediately after birth, even before cutting the cord, even before bathing or very much cleaning, right on the bare chest of the mother's bacteria, they start colonizing the baby. The baby in the womb, they are sterile. They don't have outside bacteria on their body. And what would you like? The baby to be colonized by the bacteria. Which bacteria? It should be the mother's bacteria, rather than the bacteria from the environment of the labor room and or the OT. This is the basic concept. The colostrum is immediately delivered to the child in this way. The oxytocin reflexes, they are set in very easily, and these oxytocin reflexes, they help the mother to eject the milk easily. Now say suppose if the baby is not given this type of skin to skin contact, the mother may not have proper oxytocin reflexes. Again, in case of deliveries in OT and in labor room, there are a lot of halla gulla and pain to the mother and a lot of lights and lot of anxiety in the mothers, and all these are anti-oxytocin things going on. So the first oxytocin thing is the baby put on the breast of the mother, bare breast of the mother immediately after the birth. And she forgets all those pains and allagulas and she starts releasing her milk. It also helps to expel placenta, the hemorrhage, because with placental removal, and it reduces anemia, it facilitates emotional bonding, and for the future prospects of exclusive breastfeeding, and lesser formula is needed. And because of this immediate skin-to-skin contact after the birth, the first feed is more successfully given. The better glucose control is there in the baby. We have talked about better temperature in this baby. These babies, they breastfeed for longer time, more than other children who have not been put in the breast. These babies, they cry less. They interact more with mothers. These babies, they have got better cardiorespiratory stability, and they are more efficient at sucking at the breast. And On the other side, the mothers, they become more sensitive to the child, and they have got better reciprocity. That means the mother and the child, they can interact, and they have got very subtle psychological interactions if they are uh, uh, given contact as early as within first hour. Now, how to do it? Deliver the baby straight on the mother's abdomen and chest before delivery of the placenta or any other procedures unless there is medical or obstetrics emergency. This is possible even after C-section. You have to be prepared in a different way. The baby must be dried, but it should not be bathed or uh, cleaned or washed immediately to prevent heat loss. And do not clean the amniotic fluid from the face, from the hands and forearms. Why? This amniotic fluid has got a smell which is as near to that of the smell of the secretions of the Montgomery glands on the areola. So that the by not cleaning the hands and face and forearms up to elbows or even the whole arm from the amniotic fluid can help the child to relate with the mother's breast. And the child can very well find the mother's breast by itself. You all know what is breast crawl. And this breast crawl or spontaneous feeding of the child at the mother's breast is facilitated by this process. Then place the child skin to skin without any cloth or anything in between the mother and the child, and both the areas which come in contact should be naked, and maybe in between the upper body, between the two breasts on the upper body of the mother, and then you cover them to keep them warm. Now, skin to skin contact is the best way to initiate breastfeeding through breast crawl. I think I will show you the video if it plays at the end. And this is very, very helpful. And the main thing is that how long you should continue this skin to skin contact. It should be continued uninterrupted, without an interruption, as long as possible, but for at least 1 hour or until the first breastfeed has been taken by the child. Uninterrupted means no gastric lavage, because it interrupts the pre-feeding behavior. No interruption for washing the, cleaning the child, weighing the child, dressing the child, giving vitamin K, etc. Even do not swaddle the child. So, in such a way, if you start the early initiation, the success of breastfeeding is guaranteed by the nature. So, it has been seen that if you don't give it in first hour, there is increased risk of neonatal mortality due to infections by the colonization of the bacteria from the other environment, then mother skin, and by the other people around the baby who handle them, maybe family members or maybe nursing staff who has not taken proper care for infection prevention control. There is double risk of neonatal mortality because of that. And if there is a delay in the first feed for any reason, the mother can express her colostrum and feed to the baby by cup or spoon, especially in the preterm and weak babies. And it has been seen that the colostrum in the first 24 hours has got 12,000 international or nanograms of secretory IgA. That is very, very important for the intestinal linings of the baby for proper gut maturation. And that levels, they fall immediately on the second day to 7,000 or 5,000 nanograms, and on the third day they become merely 1,500 to 2,000. So you should not anyway miss the first day's colostrum to be given to the baby, even if the baby is transported to neonatal ICU for some reason. You should help the mother and make it sure that her colostrum is expressed and transported to the NICU, where that colostrum is given to the baby. Even the babies on ventilators can be given that colostrum. It is known as trophic feeds. It means that only small amount of 2 ml or 1 ml of colostrum can be given. It is only if there is intestinal obstruction that you cannot give. Otherwise, all the babies should receive. Now, the issue is that in the first 2 days, the first day the colostrum quantity is so less that in some mothers, you may not be able to take it out on a spoon. The what we advise is that you should use a small syringe, 2 cc syringe, or if very less, then even insulin syringe also without the needle. You can suck that 1 or 2 drops which are coming from the mother's nipple after manual expression during manual expression of her milk. And all the mothers, irrespective whether of our condition or baby's condition, whether it's good or bad or whatever, all the mothers should be taught colostrum expression and hand expression of the milk. So this is the method of the hand expression of the milk that you will learn in your trainings. First, you stimulate the breast by giving gentle massage, and then keeping one thumb here and the 2 fingers at the opposite end, just after the behind the areola, and then this thumb and finger should go toward the chest of the mother, and then in the next phase they press towards each other, and then there is rolling of those thumbs and fingers, and the milk is squirted out, and then you change the quadrants. So this should be learned by everybody, and this should not be a painful condition procedure. Now about bedding in. Advise the mother baby to be in the same bed, especially off and on. You should advise while all the rounds that the baby, if it needs cleaning the urine and stool, it should be done by the mother's side only. When the mother or the baby they are asleep, don't take the baby away in the another cot in the lap of the relatives. The baby should remain with the mother, and the baby should now register the smell of the mother, the odor of the mother in all ways, and it should be registered in the baby's mind very firmly by keeping the baby near the mother, and that sets in lots of oxytocin reflexes. And keep the baby on skin to skin contact as long as possible throughout the day. So ultimately, the mother learns the feeding cues better, and baby cries 10 times less. Now tell me that as nursing staff, this is the most irritating thing that most of the nursing staff they face. बच्चा पहले दिन बहुत रोता है, पहले पूरी रात रोता है, कुछ भी दूध नहीं आता है. The baby they cry 10 times less if you follow all these advices in a protocolized way, and I guarantee you that it will be a very happy experience. This I told you just now regarding the serum IgA levels. Vitamin A and K, they are very concentrated in the colostrum, and there are many bioactive factors and lot of things they help in physiologic jaundice also. So this is about the size of the stomach that I told you right on day 1, day 2, 1 week and 1 month. So during first 3 postnatal days, the stomach becomes compliant, and then it becomes receptive to receive more volumes easily. So this is a table for average intake of colostrum that happens in the babies. So that by first day they take about 5 to 10 ml per kg, and by 3 days 66 ml, and by 4th day 5 to 7th day they take 105 ml per kg. This is the daily needs, and by this time, the first 3 days, the babies they lose about 6 to 7% of birth weight, and that is physiological. Don't give any pre-lacteals. Pre-lacteals means that giving anything other than breast milk and colostrum before it gets established, and it is not needed. These advices are mind you that all these advices that I'm giving you just now, they are for healthy term newborn babies. They are not for all preterms or non-healthy babies, for them, let the pediatrician or neonatologist decide about it. But otherwise stable babies, they all should receive colostrum and breast milk in some or the other way. So these all the healthy babies, they do not need additional water during the first 6 months, also during exclusive breastfeeding period, and not even in hot climate. A lot of studies have been done. This is all provided that you properly manage the breastfeeding establishment. Breast milk itself is having 88% water, and it is enough to satisfy baby's thirst, provided proper management is done and proper way the breastfeeding reaches to the baby. These prelactals are different types of prelactals are given in different cultures and different areas of the country and world, and it may be in form of any sugar water, jaggery water, this water, that water, or even the infant formulas. So on the contrary, they increase infections, allergies, they fill in the tummy of the baby becomes less hungry, and it attaches to the mother in a less frequently way, and ultimately it hampers the breast milk production establishment. So the prelactal feeds, they are very rampant, as you all know. And again, a lot of practice of glucose being glucose water or 5% dextrose, 10% dextrose given to baby as prelactal is actually harmful to the baby. I will not go into the very details of its science. Now, I will fast run within, I have got say about 10 minutes, and I will fast run through what you should know or what you should be trained in supporting the mother. And the first is position of the mother. The mother should be able, you should be able to tell the mother and find in which way she can be comfortable, or lying down or sitting, in which way. And you can give a lot of pillows to the mother to be very comfortable. You should misspell the myth that lying down position is not good. The mother can feed in any position. Hold the breast with C or U grip. You should learn what is that in your training programs. Then touch the nipple to the upper lip, and the nipple points and then nipple points to the nose, and interact with the baby while feeding. This is about the positioning of the mother. Baby's position, you all have must learned in your curriculum that the baby should be fully turned towards the mother, and there should be good skin to skin contact all throughout, right from the legs, thighs, tummy, chest, and the whole face of the baby. And this should be the hip, the shoulder, and the ear should be in one line, so that the baby is fully turned, and the buttock, back, neck should be well supported in different positions by the mother. This is a wrong position. Here you can see the baby is not in contact with the mother. The mother is not looking towards the baby, and she is indifferent about the baby, and the baby is just hanging around. Now you see the signs of attachment. The 4 good signs is that the baby is having a very wide open mouth. Here you can see this angle. This angle should be more than 110 degree. And with such angle, lot of areola goes inside the mouth of the baby, so that only some amount of areola is visible outside the mouth, and in such a way that more areola is visible above this mouth here than below the mouth of the child. And the mouth is so wide open. The lower lip is outturned, and the chin here is almost touching the breast. If these things are not met, there is poor attachment. The baby cannot suck properly. The baby squeezes the nipple only rather than the areola, and the mother gets nipple pain, cracks, engorgement, and everything. Again, here you see, while giving the nipple to the baby, the nipple should be targeted at the nose of the baby, and then trickle the lower lip here. And then with this, there will be a rooting reflex. The baby opens the mouth, and ultimately it itself latches. So this is the way. In the poor attachment, you can see the lip is inturned rather than outturned. A lot of areola is seen outside. The angle of the mouth is less than even 90 degrees seen over here. And the nipple is chewed by the baby, and the nipple is not going right in the deep part of the mouth of the baby up to the palate. Now, there are a few holding methods that you should all learn by demonstration and practice. The cradle hold, this is the cradle hold, where the hand of the the upper limb of the mother on the same side of that being fed is used to support the baby so that the baby is fully supported. And the opposite hand is used to grip the breast. And but then, though this is customary, cross cradle position is now found to be better scientifically. Here, the mother's opposite upper limb, then the side where the baby is feeding, is used to support the baby in this way, and the same side hand is used to grip the breast in C or U positions, and this gives better control on the head of the baby, and that helps for better emptying and latching positionings. Again, this is football position. Here you can see the lower part of the body of the baby is going towards the back of the mother, and the mother is supporting the baby by the same side hand, and this is just as if the mother is holding a football. This is good for low-term, low birth weight, preterm babies with small babies, and here the mother can very well see what is happening, how the baby is latching and everything. Upright position can also be used. This is known as Koala Hold. This is very much helpful in babies with cleft lip and cleft palate, and hypotonic babies. Babies who are not comfortable lying down, say babies with cardiac malformations or respiratory disorders. And here the baby remains upright and stable, and the baby can very well suck on the breast in upright position. Lying down position can be used. Just see that this angle is properly managed. The baby should be tucked into the stomach of the mother, and this helps in mothers who cannot sit, like in those having hemorrhoids or pain in episiotomy, etc. And there is no chance of getting the child getting ear infection, which is a myth amongst everybody. This is laid back position. The baby is lying down. This is the most natural feeding pattern. You can try it out on those babies who don't suck in other ways. And this helps the mother who are having hyperlactation also. These are positionings for twins that you should learn properly. And I end my session 2 minutes before with a very big thank you to all for being with me. I hope that most of the people might have appreciated it. You must have learned a few more things. And what I want is you all should be more sensitized towards the breastfeeding. And you should, one more point that I would like to add is that please don't fall in trap of infant milk formula substitutes, in breast milk substitutes. That is the infant milk formulas and feeding bottles. We all have got some ideas about it, and we very easily give it to the mother because we are not trained in supporting the mother in all these ways that I have discussed. So it is our moral and professional duty to learn supporting the mothers in all these ways. And there are many other things that you should be trained. And there are workshops of 3 to 14 days that are going on. And all the nursing staff should be trained in this way, because either they will be supporting the other mothers, and also they will also become mothers, the females, they become themselves the mothers, the males, they become fathers, and even fathers can support the lactating mother, and a lot of things can be done. The formula milk industry is trying to approach everybody in very different ways by giving incentives and by incentivizing the meetings and giving food and lavish hotels for such discussions which are not related to breastfeeding, but they do produce breast infant milk formula in their company. Such backdoor entries, they are being tried by infant formula industries. Please do not fall trapped to it. We have got our own moral duty towards our clients and the children of our country. Thank you very much.
Thank you very much, sir. Thank you so much for providing such valuable knowledge among all the delegates, and your words are very fruitful to all of us. Thank you so much once again for sharing your profound knowledge to us. Sir has discussed and covered many points regarding the breastfeeding, importance of breastfeeding, techniques, the antenatal counseling, the lactogenesis, exclusive breastfeeding. And yes, as per the theme of this breastfeeding week, we all are together. We have to take a pledge, and we all have to educate and support the mother and entire our fraternity. So thank you once again, sir. At the end of this, I would like to thank our patron, Dr. Suresh Khanna madam, Indravati madam, Dr. Binu Joy sir, P.S. Jain sir, and all Punit sir, Gomti madam, and all the executive committee members, chairpersons, and co-chairperson of Nursing Scholarship Scholar Society and the Chapter 17 Nemesia in Gujarat State. Thank you all. Thank you. Yes.
Thank you, Ketan sir. Thank you very much.
Thank you very much. Can I take your leave, or you want something, some questions to be answered?
Yes, anyone have doubt, then you can ask with the sir. We have 2 minutes for that. Please.
Ketan sir,
Yes.
I would like to ask sir, you said that hypoplastic breast. So if mother is having the hypoplastic breast, in that condition, how she will feed to the baby?
It is, I also told you that it is a very, very rare condition. Before diagnosing or suspecting hypoplastic breast, the patient should be referred to a lactation consultant. You should not diagnose, and also the reality is that most of the baby mothers who have got hypoplastic breast, they are also able to feed their child, and the milk production also happens. But they have to be supported in a very vigorous way. They can also give milk to their child. They can successfully breastfeed. Even mothers with cleft lip and cleft palate also can successfully breastfeed, provided they are given proper support with proper techniques.
And sir, the another question is that, as you said that during antenatal, if the mother is having the inverted nipple, it's not required to correct. And when the baby is sucking, so by its own, it will come out.
Yes.
So it is not required, sir. Directly means at the time of the breastfeeding only, the baby will do the sucking, and by that it will come out. Because
Yes.
before that, mainly in the practice, they are doing that at the time of the antenatal only. If the mother is having inverted nipple, so that time only they are trying to pull out with the help of the syringe.
Yes, that's why I included this point very categorically in this lecture, because you all are going to face this. The standard advice, the WHO also advises its manual that you should not do anything to the nipples antenatally. There are two reasons.
Yes.
One thing is that once when you in the antenatal period, the nipples are not very supple. They are not soft. It is towards the end of the pregnancy that nipples, they become very supple, soft, and stretchable. In the initial period, even till late last few weeks, the nipples are not stretchable and supple or soft. And once when you meddle with that nipple, that too with that inverted syringe thing, that is traumatic to the mother. That nipple they get, on the contrary, cracked, and that is painful. And in some mothers, it may lead to even premature labor precipitation in those mothers who are prone to that premature deliveries. So don't meddle with it. Immediately after the birth, you follow all those steps that I have enumerated with extra support in latching by the baby. The baby, see, baby doesn't latch to nipple. Baby doesn't get, milk is not stored in the nipple. That you should know, and you should tell the mother that the breast, the babies, they get the milk right from pressing or sucking at the areola. So even if the nipple is not there, or even if the nipple is there, the baby has ultimately work on the areola. It is not on the nipple. And babies with the mothers with inverted nipple may have a problem that while sucking the areola, the babies may lose the grip of the breast. So in such scenario, you have to be more supportive, and you have to be more vigorous in monitoring the latch of the baby, and see the position of the mother and position of the child also. And for all practical purposes, such nipples, they get everted out. I hope I'm clear.
Thank you. Yeah, sir. Thank you very much. Sir, one more doubt I have. Actually, before I learned that the HIV mother cannot feed to her baby. But after that, now one lecture I have attended, in that they have said that the new researchers came, and in that they have mentioned the HIV mother also can feed to the baby. So what it is, sir?
Yes, that is very important to know. Now, the scientific fact is that HIV virus can pass from the mother to the child, and the probability of the child getting HIV through mother's milk is to the tune of 10 to 15%. Now, this is quite high. So, instinctively, everybody would think that we should not give the breast milk to the child, and instead we should feed something else. Maybe some other mother's milk or human milk or other milk. But it has been seen in the field that such babies who are fed the formulas and all other types of milk at the community level, at the population level, the death rates of such babies is much more higher than number of the babies they die because of contracting HIV. So ultimately, the WHO itself came to a conclusion that, see, we are losing many more babies by not giving breast milk. So ultimately, the mathematics is like that. But if the mother or the family can very well meet that AFAS criteria for feeding the newborns with top milk, like say if the family is able to afford the cost of feeding the baby throughout, and they do not substitute their good nutrition with other diluted milk and all, then if it is really feasible for the mother to give, if it is really feasible for them to prepare, and is it sustainable? So similarly, such criteria, then they are known as AFAS criteria. It is only after the AFAS criteria are met that the mother may be advised to not to give her own milk to prevent HIV. Otherwise, for general people or the public health guidance is concerned, HIV positive mothers can give their own milk to the children, considering all these science and mathematics.
Thank you very much, sir, for the wonderful session. And today we have learned new information. There was so much lacking we felt, and all new information we have learned. So thank you very much, sir.
I would earnestly request all the organizers that please make breastfeeding training, at least 2 days training workshops compulsory for all the nursing staff, irrespective whether they are going to work in future with babies or not. It is my earnest request at the national level. And see, the importance of this is not only for the mothers and the child, it is for the country. It
Yes.
saves a lot of money also, and it is also a key to reduce the poverty also. So please pass on this message to all those who are making the curriculum, and try to arrange workshops in your institutes. Thank you.
Yeah, sir, definitely we will be implementing your suggestions, sir. Thank you very much for giving these suggestions, sir. Thank you.
Thank you all.
Thank you.
Yes, sir.